Guys, this is not a very good time for Canada. In every way, Canada is going through a lot. Canada as a country is going through a lot now, and my prayer is with them. Okay? So, apart from the immigration stress, population surges, and economic crisis that came with overpopulation due to bad immigration plans, today we have another news that is not so good to Canadians. And that news is what you're looking at right now on the screen. It says Canada has lost its measles elimination status after more than 25 years. So it's been over 25 years that Canada has been on the list of countries that have eliminated measles. You know, when you talk about measles and countries that you can say they are still prone to measles, you would just think of African countries and some other places they call third world countries. All these advanced countries like Canada, UK, US, they've been long. Measles is a long time, aged long disease that, is never heard of in their society. But today, Canada has breaking Canada has breaking that status. Canada is no more among the countries that you can say they are measles-free. What does this say about Canada? Trump, the other time he was talking about Canada, mentioned that Canada is now like a third world country. Is this true about Canada? I don't know. I'm not an expert, because before you can give your judgment about this matter, you need to have insights about certain things and how they judge people. It's by infrastructure. You can still rate Canada as part of those advanced countries, right? But talking about some other standards, I myself, honestly, I am not in a position to judge. So I'm bringing this matter here so that we can chook mouth, as my people say, so that we can talk about it and then have insight, a better insight. And so because of that, I am bringing two people who are going to analyze this situation for us. Okay, in a minute now, I'm bringing some people who will analyze. I have two experts that are going to talk about this matter. We have several sources of news sources that carry this news. So they're going to use these sources, over 10 sources. So they are going to get their facts from diverse sources and bring this matter to bear. So please follow this video to the end so that you will be informed. What does it say about Canada? What's the implication for Canada and for Canadians? For Canada as a country, its reputation, its status, and for Canadians. And then finally, for you who are planning to move to Canada, so that you have your options, you have information, and when you're taking your decision, you will be well informed. So without much ado, let me just allow you guys to listen to these two people that are very, very, they have insights. They're going to use these resources, much available on the internet, to just kind of synthesize things and give us the information that we need about this situation. So thank you so much. In a while, I'll hand over to them. But before I do that, I want to welcome you officially to Inspiration Gist with Dora, where we discuss real life issues that affect us in our society. If this is your first time of coming across this channel, thank you so much. You're welcome. Please join the trend, join the family by clicking on that subscribe button, or also by liking the video. And then most importantly for me, drop your comment in the comment section, because this is where we rub minds. So I'm not just here to talk, okay? We're here to rub minds. So please do me a favor by dropping your opinion in the comment section. After you listen to these people, what do you think about Canada? Thank you so much. Now over to them.
Okay, let's unpack this. We are tackling a truly sobering public health reversal today.
Yeah.
Canada has officially lost its measles elimination status. I mean, we held that designation since 1998. That's 27 years.
It's a big deal, a really significant setback.
So our mission in this deep dive is to give you, the listener, a clear understanding of how this actually happened. It's not just that it happened, right?
Exactly.
We need to look at the virus itself, sure, but also the systemic weaknesses, the cracks in the system that it exposed.
And the official confirmation came down November 10th, 2025. The Public Health Agency of Canada, PHAC, made the announcement.
And the technical reason from PAHO, the Pan American Health Organization.
Well, it's quite specific. They confirmed sustained transmission of the same strain of the measles virus
The saving strain.
for more than one continuous year. That meets the criteria. It means measles is now considered endemic again. It's circulating here.
Endemic, meaning it's established. It's not just imported cases popping up anymore.
Precisely. Unless we manage to aggressively interrupt that transmission chain again.
And the outbreak that led to this, it started back in October 2024 in New Brunswick.
Yeah.
Right. But the scale is just startling.
It really is. We're talking over 5,000 confirmed and probable cases.
5,000.
Spread across 10 different jurisdictions.
Right.
Think Alberta, BC, Manitoba, New Brunswick, the territories, Nova Scotia, Ontario, PEI, Quebec, Saskatchewan. It's coast to coast to coast almost.
Wow.
And, what really stands out in the sources, and it underscores just how serious this is the human cost. There were 2 infant deaths reported, one in Ontario, one in Alberta.
Oh, that's awful. How?
These poor babies were actually infected in utero, born prematurely, and then died shortly after birth because of the measles infection they got before they were even born.
That's just tragic. It really brings it home, doesn't it? This isn't just about losing a status symbol.
Absolutely not. It's about profound human tragedy, vulnerable lives lost.
So how did we get here? A country that eliminated measles nearly 3 decades ago. How did we fall so far? The simple answer, I guess, has to be about herd immunity, right?
That's the fundamental problem, yes. Measles is incredibly contagious, one of the most contagious diseases we know.
Right.
And to stop it spreading in a community, you need that herd immunity. For measles, the magic number is 95%.
95% coverage with the 2-dose vaccine.
Exactly. That's the threshold needed to protect the whole community, including those who can't be vaccinated.
And the data shows Canada slipped badly below that line. 2-dose coverage for kids age 7. It dropped from 86% in 2019.
Which was already below the 95%, mind you.
True, but it dropped all the way down to just 76% by 2023.
76%. That's a huge gap, way below the safety net needed for measles.
So what caused that dramatic drop? Public health experts seem to point to 2 main kind of intertwined reasons.
Yeah, it's the synthesis, yes. First, you had the very real practical disruption from the COVID-19 pandemic.
Right. Routine immunizations got put on hold, clinics closed.
Schedules were missed, catch-up efforts just didn't keep pace everywhere. That created a cohort of under-vaccinated kids.
Okay, so that's the logistical side. What's the second factor?
The second one is, well, arguably more complex and maybe more insidious. It's the rise in vaccine hesitancy, fueled largely by misinformation and linked to this broader trend of growing distrust in government, in public health authorities.
And this wasn't just happening in a Canadian bubble, was it? The sources mentioned connections elsewhere.
No, definitely not isolated. The specific measles strains found in these Canadian outbreaks matched strains that were circulating in Texas and also in Chihuahua, Mexico around the same time.
Interesting. So movement across borders plays a role.
It does.
Yeah.
And the sources highlight that these outbreaks were often concentrated within specific under-vaccinated communities.
Right. I saw mention of certain Mennonite Christian communities.
Yes, particularly groups whose populations often migrate between communities in Canada, the U.S., and even parts of South America.
So these tight-knit communities with lower vaccination rates moving across borders.
It creates a perfect pathway for the virus. Measles is opportunistic. It finds every gap in immunity, and borders don't stop it when you have connected, susceptible populations moving back and forth.
Okay, let's shift a bit and talk about the organized side of that vaccine hesitancy. The sources name one group specifically, Vaccine Choice Canada, or VCC.
Yes, VCC is identified as the main anti-vaccination group in Canada.
They're not new, are they?
Not at all. They've been around since 1986, originally under a different name, VRAN.
And their core message involves claims that vaccines cause autism.
That's one of their key, long-standing claims, which has been thoroughly debunked by scientific research. They also link vaccines to a whole host of other conditions, learning disabilities, ADHD, allergies, asthma, again, without credible scientific evidence.
And their activity goes beyond just spreading these ideas, right? They actively campaign against vaccination.
Oh, absolutely. They explicitly encourage people to forego immunization, and they were very vocal opponents of public health measures during COVID-19, things like masks and vaccine mandates.
So it's not just about questioning the science, it's an active push against public health policy.
It seems to be tied into a deeper ideology. You saw that in 2020 when they actually filed a lawsuit against public health measures.
A lawsuit? On what grounds?
They alleged violations of constitutional rights, but interestingly, the lawsuit also referenced conspiracy theories about a new world order or a new economic world order pushing for mandatory vaccines and surveillance.
Wow. Okay, so let's tap into some pretty far-reaching conspiracy theories.
It certainly suggests a broader anti-authority stance, going beyond just medical concerns. And remember their billboard campaign back in 2019.
Vaguely, yeah. In Toronto.
That's right. Around 50 billboards across the Toronto area displaying what were described as half-truths messages designed to sow doubt about vaccine safety. Very visible, very public.
So when you have that level of organized opposition, spreading doubt and mistrust, it must make controlling an outbreak incredibly difficult.
It absolutely does. It erodes the very foundation you need for public health interventions, which is trust.
Which brings us back to what Dr. Lenore Saxinger said, that quote about trust building.
Exactly. She said, there's a lot of trust building that's required with some groups of the population. It's essential work.
And the example of the Mennonite communities in Ontario really highlights that, doesn't it?
It does. The sources mention community liaisons like Catalina Friesen, who worked with these groups.
Right.
And her observation was fascinating. She noted that the distrust wasn't necessarily about the measles vaccine itself.
Oh, what was it about then?
It often stemmed from deeper historical issues, a feeling of resentment about being told what to do by authorities based on past experiences, maybe even going back generations, mistreatment by officials.
I see. So it's a long-term relationship issue, not just about this one vaccine.
Precisely. And rebuilding that trust isn't a quick fix. It requires sustained effort, working with the community, often led by people from within the community.
Okay, so we've got low vaccination rates, the epidemiological problem, and we've got the distrust and misinformation, the sociological problem. But the sources point to another huge piece of the puzzle, systemic flaws in our own public health infrastructure.
Yes, this is critical. A major issue is the lack of a truly coordinated national immunization strategy.
What does that mean in practice?
Well, what's really striking is the fragmentation. We have 13 provinces and territories in Canada, and each one sets its own vaccine schedule. They're all different.
Wait, really? So the shots your kid gets and when they get them depends entirely on which province or territory you live in?
That's exactly right. Take the MMR vaccine, or MMRV, which includes varicella, chickenpox. Everyone needs 2 doses for measles protection.
Okay.
But when you get that second dose, varies wildly. Most provinces might give the first dose around 12 months and the second around 18 months, or maybe school entry.
Seems reasonable.
But then you look at BC, they give the first dose at 12 months, but the second isn't until age 4 to 6 years. Ontario also spaces them out differently. There's no single Canadian schedule.
That seems chaotic. Does it matter medically when you get the second dose?
Well, there's actually some debate among experts on the optimal spacing. Some evidence, like research cited involving Dr. Vanita Dubé, suggests that spacing the doses further apart might lead to a slightly more robust long-term immune response.
Okay, so maybe spacing isn't bad.
But other experts, like Dr. Joanne Robinson, argue that giving the doses closer together, say at 12 and 18 months, is crucial. Why? Because some infants, maybe 5–10%, don't get full protection from the first dose. Waiting until age 4 to 6 for the second dose leaves those kids vulnerable for years.
I see the dilemma. Protect better later or protect more kids sooner.
Exactly. And with measles being so dangerous for young infants, the argument for closing that immunity gap earlier is pretty strong.
So if the experts disagree, imagine being a parent moving between provinces. You mentioned Jade Medeiros.
Right. The example of a family moving from Ontario to New Brunswick. Suddenly, they find their child is considered behind on vaccinations according to the New Brunswick schedule.
Even though they were up to date in Ontario?
Correct. The new school might not accept their records. They scramble to catch up. It causes immense confusion, stress.
And kids inevitably fall through the cracks.
Easily. Especially with families moving more frequently these days.
This fragmentation seems like a major vulnerability, which leads directly to what sounds like the biggest infrastructure problem of all. No national vaccine registry.
Bingo. This is arguably the most critical systemic failure highlighted in the sources.
A national electronic vaccine registry. It sounds like something we should obviously have.
You'd think so. And this isn't a new call. The Canadian Pediatric Society pointed this out way back in 1997.
1997. Wow.
Yes. A paper back then called for harmonized schedules and noted that comprehensive shared electronic record-keeping systems were basically a distant dream.
And nearly 30 years later.
They still feel like a distant dream, astonishingly. The situation now is patchy at best.
So what do we have?
Only 6 provinces currently have dedicated electronic vaccine registries. 6 out of 13.
And are those 6 connected? Can they talk to each other?
Nope. None of them are connected nationally. There's no way to easily share records if someone moves from, say, Alberta to Nova Scotia, even if both have registries.
Unbelievable. What about Ontario, the biggest province?
Ontario's system is particularly fragmented. It still relies heavily on parents reporting vaccinations to local public health units, often using paper records, or on individual family doctors keeping track. If you don't have a family doctor, or if records get lost.
It's a mess.
It's a huge gap.
So what does this lack of connected data actually mean when an outbreak like this hits? What are the consequences on the ground?
It's paralyzing for the response effort. Think about it. Someone shows up in an ER with measles symptoms. Doctors often have no quick, reliable way to know their vaccination status.
Wasting precious time.
Exactly. And when there's an exposure, say, in a school or daycare, public health workers have to spend days, sometimes weeks, literally chasing down paper records from different clinics, different health units.
Instead of contact tracing and containing the spread.
Right. And maybe the most critical point for day-to-day prevention. Think about the millions of Canadians who don't have a regular family doctor.
Yeah, that's a growing problem.
Without a connected registry system, there's no reliable automated way to remind people their or their children are due for vaccinations. No central recall system. So huge numbers of people just drift away from the recommended schedule, leaving gaps in community protection.
So pulling it all together from this deep dive, Canada's loss of measles elimination status wasn't just one thing. It was like a perfect storm.
I think that's a fair way to put it. It's a complex failure stemming from several interacting forces.
Okay, so number 1, vaccination rates dropped dangerously low.
Yep, falling well below that crucial 95% herd immunity threshold.
Number 2, that drop was driven by both pandemic disruptions and this growing wave of vaccine hesitancy, fueled by organized disinformation campaigns that actively eroded public trust.
Correct. The social and the logistical factors combined.
And number 3, all of this played out against the backdrop of an outdated, fragmented public health infrastructure, no harmonized national schedule, and crucially, no shared electronic vaccine registry.
Those systemic weaknesses made us incredibly vulnerable when measles came knocking again.
So where do we go from here? Can Canada get the elimination status back?
Yes, it is possible. The goal now is clear. Interrupt the transmission of this specific, currently circulating strain of measles.
How long do we need to do that for?
For a continuous period of 12 months, no endemic transmission for a full year.
Has anyone else done this? Lost and regained status?
Yes, it's happened before. Venezuela and Brazil, for example, both temporarily lost their elimination status in the past due to outbreaks, but eventually managed to regain it after getting transmission back under control. It's an arduous path, but it can be done.
What's the current risk level for people in Canada right now?
PHAC assesses the overall risk to the general population as moderate. Obviously, the risk is much higher for unvaccinated individuals.
And is work underway to fix things? Boosting coverage, improving data.
PHAC states they are working with provincial and territorial partners on exactly that, trying to boost vaccination coverage, strengthen data sharing where possible, and improve surveillance to detect cases quickly. It's a major focus now, as you'd expect.
But getting back to that core issue of trust and choice, it seems like there's a tricky balance needed going forward.
Absolutely. The path forward really requires 2 parallel strategies, doesn't it?
How so?
Well, first, we absolutely have to promote and deliver vaccination to everyone who is willing. That's the cornerstone of prevention for a virus like measles. We need to make it easy, accessible, and trusted.
Okay, makes sense. What's the other track?
For those individuals or communities who, for whatever deeply held reasons, ideological, historical distrust, choose not to vaccinate, public health still has a duty to protect the wider community, meaning ensuring that essential public health measures are still followed, even by those who refuse vaccines. Things like isolating immediately if you're sick with symptoms, cooperating with contact tracing. It's about minimizing the harm their choice could cause to others, especially the vulnerable.
That's a tough line to walk. Which brings us to the final, maybe provocative thought for you, our listener, to chew on. The data is stark. 92% of measles cases in the recent U.S. outbreaks, and the clear majority here in Canada, were among unvaccinated individuals. This was largely preventable.
The vaccine works extremely well when used.
Right. So the fundamental threat, the misinformation, the anti-authority sentiment, that isn't going away quickly.
Right.
But here's the question. Will the shock of losing this 27-year elimination status finally create the political will needed to fix the infrastructure?
You mean specifically the registry?
Yes. Will Canada finally move past the paper records and the provincial silos? Will we actually build that national, harmonized, shared electronic vaccine registry that experts have been calling for since 1997?
It's the key question, isn't it?
Because without that basic modern public health tool, it feels like we're just setting ourselves up for the same chaos the next time a highly contagious, vaccine-preventable disease inevitably emerges. We'll be having this same conversation again.
Let's hope this time is different.
Thanks for watching Inspiration Gist with Dora. Don't forget to subscribe and click here to watch our next video.